Next, we'll be showing you Petrissage. Petrissage is a deeper stroke, a more firmer stroke than effleurage. It means literally to knead, and we are going to be picking up and compressing and kneading the muscle, kneading the soft tissue as if it was bread dough. Okay, so once I've warmed it with my effleurage, then I can come into a particular muscle or group of muscles and do my Petrissage. So you want to be lifting up, okay? And I'm not doing this with my fingertips. This would be pinching. This would be very uncomfortable. I'm using the full palm of my hand to lift and to knead. Fingers, nice full palms. Okay, I can do something like this. And as I come up, I compress the muscle in between the hands. So this would also be a type of Petrissage. This is two-handed Petrissage because I'm using two hands. Okay, I can do one-handed Petrissage and just use one hand. But again, in order for this to be Petrissage, I have to be lifting up the muscle. Okay. I can also do what's called two-finger Petrissage, which would be appropriate for smaller areas. The back of the heel here at the base of the Achilles tendon is a good area to do two-finger Petrissage. Okay, so I just come in and I'm lifting up these muscles and tendons here with two fingers. And again, notice I'm keeping constant contact with the client. I'm not lifting up and losing contact like this. Constant contact at all times, no matter what I'm doing, what stroke I'm doing. Okay. Another style of Petrissage is compression. Okay? Compression is a nice stroke to do when you are opening up an area or when you're closing an area, and it is exactly what it sounds like. You are just going to be compressing your body weight into the muscle. Okay, so you want to stand next to the client. Okay, and you want to just put your full palms into the muscle and then just lean your body weight forward. Okay, you just lean your body weight forward, compress. So I am compressing the muscle into the bone underneath. The bone is giving me resistance. Okay, you can do it also with your forearm. So I can come in here and I can just lean in. All up and down the muscle. I don't want to do compression over the popliteal space, so this is an endangerment site. Okay, so I'm gonna. Okay. Also, when you're using your forearm like this, you want to make sure that you are using your arm where your hand can be on the outside of the table. If I was using my arm like this, you can see where my hand is going to be too close to the client's genital areas or personal space. So position yourself so that your elbow's on the inside of the leg and your hand is off the side of the table. Okay, that's compression. Okay. Our next Petrissage stroke is chucking. Chucking is only done on the limbs, okay? And it's really for the leg, it's going to be down here towards the ankle and the cruce, or up on the forearm mostly, okay? Chucking, you want to support the client's foot or ankle so that you can keep it nice and stable. Okay, and you are going to start, and remember, we want to go towards the head as much as possible, towards the heart, I should say, and just grasp around the client's ankle nice and firmly, and this is going to be a very quick stroke. So chucking looks like this. Back and forth. Say again? Is that right?
Yeah, that's right.
Okay. Okay, and as I'm doing this, I'm squeezing the muscle and I'm, again, lifting it and picking it up as I'm coming up here. Okay, notice that my shoulder and body are moving not my arm, okay? But I'm propelling myself forward. Okay? Okay, that's chucking. Okay. Fulling, which is a stroke I don't use very often. Oh, yeah. So next would be fulling. Okay, so again, fulling is best on the limbs. Okay, so I'm going to grasp around the muscle that I want to work. Okay, and I want to have my thenar eminences, my thumbs together, grasping around the muscle. Okay, and I'm going to lean in with my body weight, and as I do, my hands are going to separate. And then when I get down to the table, I'm going to lift them back up. And as I do, I'm compressing and squeezing the muscle, lifting it up. So we do it a little bit faster. Down, lift up. Spread down, lift up. Spread down, lift up. Right? So that's fulling.